Hello and welcome. I'm Meenakshi, and today I'm going to guide you for the yoga practice for your third trimester. And in this trimester, the baby weight is increasing, and your baby is taking the big room in your uterus. And now your uterus is pushing your diaphragm upward, and because of that, you feel breathlessness a lot of time. You feel fatigue, heaviness. You feel hard to take turns while you lie down, indigestion, heartburn, So, in this practice, my aim is to support the body but not push the body. And we're going to work on the nervous system. So, let's start with the practice. We're going to start with some breathing first so that you feel relaxed in the beginning only and you can continue the practice. So just resting palm on your knee and keep your back straight. So from here, close your eyes. Inhale through the nose. Exhale through the mouth. And at the same time, you're just relaxing your back. Inhale through the nose. Exhale through the mouth. Again, inhale through the nose. Exhale through the mouth. And release. And slowly open your eyes. Now, okay, so in the next practice, you can just come to cat and cow. And just come to the palm and come to the knee. Cat and cow position. And then inhale. With inhale, roll the shoulders back and look up. Exhale, hinging your back. Inhale. Breathe out, lifting the back higher as much you can. Just work on your spine. Inhale. Also, you will feel the stretch under your diaphragm here, and sometimes this part becomes really tight at this time. So when you are doing this movement, it's helping you to stretch and creating more space for inhaling the oxygen. So keep doing few more time. Exhale. Inhale. And exhale. Inhale. Exhale. Now you can just bring your toes together, knee wide open, and just try to sit back. And you can bring your palms back slightly. Just push your heels down through your hip, and but make sure you're not pushing your womb or you're not pushing your belly. So make sure there is no extra weight. And now we going to enter in the cat and cow position again, and then you can just lift your left leg up, and we're going to create the circles from here just 5 times. Keep breathing. And at this time, especially because of your sleeping position most of the time at the left side, you feel discomfort in your SI joint, and sometimes you have sciatica pain as well. So it's important that you do this kind of mobility work and pelvic tilt work. Okay, so now let's do it to other side. Make sure your balance is on the both palms equally, it's not at the one side. And then just keep breathing. You can do either 5 times both sides, or you can do 10 times, just depending on your capacity. And then from here, just tuck the toes in and lift your knee up. So just come to the downward facing dog pose position. Lift your tailbone high, and then from here drop your knee down again. And this time I request you to use the blocks. If you have like whatever equipments you have a blanket or blocks or whatever you have, you can use, or you can use two hard pillows also to get some height. So I'm using these two blocks, and then you can just step your right foot front. So just check your comfort level to step your right foot front from here, and you use the block and then push your front knee front. If you don't have block, you can still interlace your finger and then push your front knee front. Also, you can use a blanket under your back knee if you find it hard. Okay. Then push it front. And now, this time your hamstring becomes really tight. So this muscle becomes very tight. So we need to stretch it. So you can slide your front heel front and feel that you pulling your hip backward towards the back wall. Okay. So you can gently bend the knee, like soft knee bend, and pull your hip backward. You feel the stretch in your hamstring. So you can feel the stretch here. Okay, you can feel it more when you bend your knee and just look front. Keep breathing. Inhale and exhale. And then from here, slide your leg back. You can sit back once just to get some rest in between for your chest and to relax your heart. And then from here, once uh, again to other side, your left side. So step your left foot front and then push your front knee front just to open up from your inner thighs. Push your front knee front and look front. And then from here, slide your heel front and soft knee bend and pull your hip backward. Stretch your hamstrings. So I'm pulling my hip backward instead of taking my leg front side. I'm pulling my hip backward, and if you keep your knee soft bend, as I'm saying it again and again, it should not be too much bend or it should not be very straight. So soft bend and then pull the hip backward. You start feeling in your hamstring. And and from here take your leg back. Now I request you to use these two blocks, one on each other. So either you can use this one, otherwise you can use two pillows also. So if you have a bolster, you use that bolster. Otherwise, you can use the pillow. So anything is fine. So now I'm going to sit on these blocks just to practice malasana. Okay, so deep squat position. So with your elbows, you push your knee out. You can feel in your inner thighs. With your elbows, keep pushing the knee out as much you can. And if this position is really comfortable for you, this then you can just remove one block. Okay, so this practice will prepare you for your childbirth. And now I'm going to remove one block, and then I'm trying to sit a little bit down, and then again push the knee out. And now you're just going to sit back, and then just come to the back side of the mat and sit with the straight leg. So I'm just removing these blocks, and then bring your right foot on the left thigh. Place it on the left thigh, and then you can just keep your fingers beside. Make sure you're not hinging the back. That is not a good posture for your baby, for your uterus. So make sure you're keeping the back straight and you're just bending from the lower back. Very gentle. Keep it very gentle. And now take your palms back, slightly lean back, and then you're just going to slide your heel back. And you will feel the stretch at the outrage of your right hip. You will feel in your sciatica. So if you can do it slightly more, then again bring it back. But make sure you're not pushing yourself too much, and you're not pushing yourself more than a limit, because this time in the third trimester, it's not a good time to push you more than your limit. Make sure you are doing effort 60 to 70% of your capacity, and you're not doing it full of your capacity. Okay? And then straighten the leg and right leg straight. Now you're going to change, bring your left foot on the right thigh, and then same thing. You just keep your hands beside and slightly gently bend forward. Make sure there is no pressure here. If you still feel that pressure, then just stay straight and just feel like you're pulling your hip backward. So deep forward bends is not recommended in your pregnancy. Now take your palms back, and then you're just going to slide your heel back. So again, you can feel the stretch here. So this muscle become really tight, and it blocks the nerve sometimes when you have reduced blood flow because of your lying down at the one side only, at your left side mostly, and you feel some kind of restlessness in your leg. So it's important that you do this kind of stretches which relax the muscle, and improve the blood flow in your leg, and so that you can sleep better. Also, there is another reason. At this time your baby has some more movements at night, and sometimes you feel like not to sleep properly. So these kind of stretches will calm down your nervous system, and it will help you to improve your sleep. Okay, so release. Now we're going to work on the calf muscle, especially because during the pregnancy you have lot of blood flow towards the uterus, and from the uterus towards the legs. So you have lot of blood flow, and sometimes you get varicose veins also. Sometimes you have swelling in your feet, also in your hands. So make sure you stretching and relaxing this muscle. If you're doing this contraction work a lot on the calf, then it's not going to help. As per my experience, it didn't help me as much. So the stretching really helped for the calf. Okay, so from here, keep the toes in and relax. Okay, again, keep the toes in and relax. Now let's do some ankle rotation and then try to stretch your calf. That's 5 times clockwise and then 5 times anti-clockwise. 2, 3, 4, and 5. Release now. And from here, again, come to cat and cow position, and then you slightly come back, palms on the waist, and step your left foot front. If you want, you can take support like from the blocks at the side if you want, but just totally your choice. Otherwise, you can just simply bring the palm on the waist and try to step your foot front. Okay, and then inhale all the way up. Now you're going to open your leg wide and keeping your toes out, come to the goddess pose, Devi Asana. So from here you're going to bend your knee and then join your palm in front of the chest. So make sure your knee is not coming in, it's harmful for your knee ligament, and make sure there is no space under the back of the foot. So you're pushing the back of the foot and you are creating an arch here. Okay, so pushing it back, join your palm in front of the chest and inhale, release. From here again, join your palm down and release. Just 5 times. Keep breathing, increasing the stamina, increasing the health of your legs. So from here down and release. 3. Keep breathing. Go slow and down. 4. Release. Okay, and then last one and 5. Release. Okay, now bring your feet together and then, so let me start from here so that you see me properly. So take your right leg back. So I'm turning my back foot out and my left foot is as it is there. Okay, and then you bend your left knee. You can drop left elbow down and right hand stretch over your head. Parshukonasana. Make sure you have equal weight on your both feet. Inhale up. Okay, now you're just going to bring your right palm on your belly, under the belly, and then take your left hand stretch over your head so that you create more space uh, in your belly. You can bend your knee as well, or you can keep it straight, whatever you find is comfortable. And now you're going to turn to other side. So my right foot, I'm turning to the right side, is the same thing, and left foot to the front. Okay, now you can bend your knee, right knee, drop your right elbow down, and left hand stretch over your head. Few breaths. You can try to lengthen from here, shifting your body weight equal on your both feet, and inhale up. Then bring your left palm under the belly and right hand stretch over your head. And then release from here, turning your feet in and bring your feet together. Now you just can simply sit all the way down, just taking support, and then sit down. You can use a block. Oops. You can use a block under, and you can sit on the block, and then just resting palm on your knee. And once again, we're going to do some breathing. So from here, keep your right thumb on the right nostril. Breathe out from the left. Breathe in from the left. Breathe out right. Breathe in from the right. Left. In from the left. Out from the right. In from the right. And now you can remove the block or the pillow, and then you can lie down at your left side, and you can use the pillow in between of your knee. So you don't have to lie down on the back. Just lie down at the left side. Close your eyes. And then same way you can push your right arm on the floor and you can sit up. Okay, namaste.